All right, the pros and cons of TRT. Let me start this off by saying the reasons why I wrote The Man Diet and created Man Greens and all the other supplements was because I was told to get on TRT at a young age because of my low T levels. That plunged me into years of research, trial and error, and finally the knowledge of how to naturally increase testosterone levels, bringing my T levels from the low 400s to the 900s again, naturally. So I 100% think that the natural way is the best way. And you can 100% increase your testosterone levels naturally with lifestyle changes by losing fat and getting to that 14% body fat mark, improving sleep, proper diet, that is eating the foods that help you boost T, and removing the foods that hurt your testosterone levels, and effective supplementation, which can increase your testosterone levels naturally by 200 to 400 points on its own, which is pretty big. I'm for the natural way. But does that mean TRT is never a viable option? No man should have low testosterone levels, and sometimes TRT is a viable option, and we're going to get into it in this video, just when it is, if there are side effects, and who should be on it and who shouldn't. So let's get into it. Historically, low testosterone has mostly been a problem for the middle-aged and beyond. Research shows that 39% of men over 45 suffer from it. Another study shows that while 13 million men in the US may be deficient in testosterone, fewer than 10% get treatment for it. That's an enormous number of guys living life with the handbrake on because of their low T levels. Even more shocking is the fact that these statistics only account for men that were clinically deficient. It ignores the millions, many of whom are young, whose lab tests indicate they are fine, but based on their symptoms are almost certainly deficient in testosterone. Furthermore, these figures don't account for the fact that young men don't typically get their T levels tested. Many millions of them are quite possibly deficient too. Not because of old age, but because of things like environmental estrogens, overexposure to chemicals, a crappy diet, and because of a soft, comfortable, convenient, low testosterone lives they lead. There are a couple of caveats to throw in here. One, since men's testosterone levels are dropping overall, the numbers they measure normal testosterone levels by have also dropped. So being average in modern times is actually low testosterone levels. Number two, the reason for this decline hasn't been studied all that much, and I'm also talking about the decline that happens at 30, typically for every man. You may automatically think that the decline is because of the number, the age. But age is very subjective. One man can have the body of a 20-year-old and be 40, while another man can be 40 and have the body of an 80-year-old. My belief is that the decline has to do more with lifestyle than anything, and that you can maintain high testosterone levels well into your latter years, naturally. Also consider the fact researchers speculate that testosterone levels of today's average man are roughly half of what his grandfathers were at the same stage in life. Because of this, testosterone is a hot topic, and so it should be. Optimal testosterone levels are vital. They reduce the risk of depression. High natural T levels also equates to more muscle mass and more efficient fat loss. It's a hormone we naturally have within us that helps us look and feel the way we want to look and feel. As I've said before, we're literally better at who we are if our testosterone levels are thriving. Low levels of testosterone can be disastrous for your quality of life. Subpar T levels can cause increased body fat, reduced strength and muscle mass, decreased bone density, low libido, erectile dysfunction, infertility, depression, fatigue, and anxiety. For this reason, I suggest you do these three things. 1. Get your T levels checked by your family doctor. 2. Understand that if they prescribe testosterone replacement therapy, it can be a viable option and an effective approach, but it doesn't actually help your body produce more T on its own. 3. Before considering TRT, try and optimize your lifestyle to boost your own production. Use the tips and routines I'm about to outline, then get your T levels tested again and assess if your levels are optimal. If not, you might be a candidate for TRT. Before I dive into the pros and cons of TRT, let me examine what you can do to drive your natural testosterone production up to ideal levels. Optimal levels of testosterone can make you feel like Superman. It does cool stuff to the body, but this doesn't happen overnight. If you suffer from low testosterone, getting your levels back up to scratch will help you feel pretty good quite quickly. But you need to stay consistent to feel the full benefits. Diet, sleep, lifestyle, and intelligent supplementation can all help you keep your T levels where they need to be for you to thrive. Your diet can have a huge impact on testosterone levels. A recent study looked at the effect of consuming dietary fat on levels of sex hormone binding globulin SHBG, free testosterone and cholesterol in men. After consuming a diet with a high fat content, greater than 100 grams of fat a day, 2 weeks, the mean plasma cholesterol level increased while the mean sex hormone binding globulin level decreased. About 2/3 of your testosterone is bound to SHBG and not free. Some believe that free testosterone is the only form of testosterone that counts, as it's the only form of T that can actually work on your tissue. More on that subject later when I explain the test to consider getting done. With that initial intro into the importance of fat consumption and cholesterol on T levels, let's dive deeper. Here are some of my favorite dietary strategies to boost testosterone. Eat foods high in good fats. Make sure you include the following foods that are high in powerful fats in your diet on a daily basis. Eggs, rich in testosterone boosting cholesterol, saturated fats, and monounsaturated fats. Unpasteurized raw organic milk can be good. Milk that's high in good fats, nutrients, but without all the added hormones they pump into pasteurized milk and the cows that produce it. Hormones that can raise estrogen levels in men. And meat. Grass-fed beef or game meats is a great option for saturated fat. Opt for grass-fed to avoid the hormones pumped into the mass-produced cattle found in most grocery stores. Next up, aim to eat foods high in the mineral zinc. A study at the University of Tehran found that zinc raises testosterone levels by inhibiting the enzyme aromatase from working. Aromatase is an enzyme that converts testosterone into estrogen. Foods like red meat, oysters, beans, and pumpkin seeds are all high in zinc. Include these in your diet on a regular basis to stop the flow of estrogen and raise your T levels. A diet high in vegetables, especially green leafy ones, is also a smart choice. Two of my favorite T boosting veggies are broccoli and garlic. Broccoli is high in indole-3 carbinol, a food compound that can help reduce estrogen in half in men. Garlic contains allicin, an ingredient that raises T levels and lowers cortisol. Right, let's look at the other factors within your control that can help you improve your T levels. First up, sleep. Research clearly indicates that sleep deprivation lowers testosterone. A single night of sleep deprivation sends your levels of the stress hormone cortisol through the roof. Testosterone is a cortisol antagonist. They work in a kind of seesaw fashion. When one is up, the other is suppressed. So living with chronically high cortisol means probably suffering with chronically low testosterone. Furthermore, chronic sleep deprivation drops your testosterone and growth hormone. It also weakens erections and sexual health considerably. Fixing your sleep can go a long way to fixing your testosterone production. In a recent video, I did a deep dive on sleep. In it, I gave my key tips to guarantee you get the best possible sleep. Let me quickly recap those now. Get the best mattress you can afford. Get outside and get some sunlight during the day. Have a sleep routine, which is probably the most important thing. Get off your smartphone and other devices at least an hour before bed. Supplement wisely. Man Sleep is an awesome supplement that you should consider. If you struggle with poor sleep, the ingredients in it were a game changer for me. Next, let's look at your training. Your training can have a positive effect on testosterone levels. Don't just do hours of mindless cardio. Lift like a man should. Not only does weightlifting help decrease body fat and increase muscle mass, resulting in higher testosterone levels, but it directly affects T levels. You need resistance training. Multi-muscle, multi-joint exercises like squats, deadlifts, rows, presses, and O-lifts help you naturally raise both T levels and human growth hormone levels. Build your training around high-quality, intense weightlifting workouts that prioritize the big multi-muscle, multi-joint exercises to keep your T levels at their peak. Smart supplementation can help drive your testosterone levels up to the levels you need to feel like you're living with purpose, energy, and vigor. Man Boost is a great example of a supplement that works synergistically with a healthy diet and lifestyle to help you reach optimal testosterone levels. It contains rare minerals and natural ingredients that have been studied to help lower estrogen and boost male hormone health. It contains nutrients that help naturally block estrogen by two methods. One, by flushing chemical estrogens out to the liver with IC3, one of the rare ingredients that actually does this. Number 2, by blocking the process by which your body converts testosterone to estrogen. I love Man Boost, but don't just take my word for it. Listen to these reviews from guys like you who've tried it themselves. First, you're not going to find another quality testosterone boosting product such as this for the same cost. Buying the individual ingredients separately costs much more, and it requires you to take way more pills. Man Boost is a great supplement for healthy testosterone production. It has the clinically effective doses of high quality ingredients. The specific type of zinc that's used in the supplement is more bioavailable, and with all your estrogenic chemicals in our environment, it's an absolute must for optimal testosterone production. I absolutely love it. If you follow my tips and supplement wisely, I'm confident your T levels can climb significantly. Sadly, some of you might find your production still suboptimal despite doing everything you can naturally do to boost them. At this point, you might be tempted to pursue TRT. Before you do, you owe it to yourself to do your research. I've done plenty of research for you, and here are the key points. Testosterone replacement therapy is as much an art as it is a science. The correct delivery method and dose is individual and requires an expert who can apply the science to your situation. This is a skill. Sadly, most doctors aren't equipped to deliver this skill at a high level. Next, a normal testosterone reading means almost nothing. You need to have total testosterone, free testosterone, and bioavailable testosterone measured to get a reasonably accurate hormonal picture. Testosterone replacement therapy, or TRT, should be given based on symptoms instead of blood values. If you have no energy, gain fat easily, have trouble putting on muscle, have low libido, and suffer from depression, you may need TRT. Next, there are numerous types of TRT, including gels, injections, creams, or pellets. Some benefits of TRT happen quickly while others take years. Libido can improve within weeks, as can depression, but loss of body fat and an increase in muscle takes months to plateau while continuing on at a lesser pace for years. TRT, like any medical treatment, can cause some side effects. Some of those associated with TRT are pretty scary. One of the scariest is the link between TRT and prostate cancer. I have some good news though. Researchers found that men who'd been prescribed testosterone for longer than a year not only had no overall increased risk of prostate cancer, but their risk of aggressive disease had been reduced by 50%. In another study, researchers in the United Kingdom looked at 1,400 men who had received testosterone replacement therapy for up to 20 years and found only 14 cases of prostate cancer over the course of the study. Dr. Malcolm Carruthers, medical director at the Centre for Men's Health in London and co-author of the study, states that this myth about testosterone replacement therapy being linked to prostate cancer has been rooted deep in medical consciousness for over 60 years. But this paper says no, testosterone treatment is actually good for prostate, not bad. Here are some answers to some of the other key questions that crop up about TRT. Do I have to inject myself? Doctors are more likely to prescribe testosterone creams and gels for practical reasons. Let's be honest, not many people want to jab themselves with needles, do they? However, creams and gels are hard to dose properly. If you aren't scared of injections, a prescription for injectable testosterone is more likely to provide a consistent and easy to monitor dose. Gels provide a much more natural androgen rhythm that mimics the body's natural rhythms. However, gels have their drawbacks. From a practical perspective, it may be easier than jabbing a needle in yourself, but there are issues to consider. You should only apply gels to freshly showered skin. You should refrain from swimming or working up a sweat for at least an hour. Importantly, you can't, under any circumstances, let a child or female, especially a pregnant one, come into contact with the treated area until it's absolutely dry. If you do, you risk skewing their hormonal profile and causing negative outcomes. How often do I take TRT? While some doctors administer testosterone injections every 2 or 3 weeks, that method can lead to problematic spikes of blood levels of the hormone, followed by problematic low blood levels as the shot begins to wear off. Once weekly shots seem to be the preferred method by some more progressive doctors. Next question is, how much testosterone will they give me? The most common TRT dosage is 200 milligrams every 2 weeks. As I just mentioned, this might result in undesirable peaks and valleys in your T levels. For most men, 100 milligrams a week is enough for effective TRT. However, some men need less and some men need more, possibly up to 200 milligrams a week. Beyond this point, you've crossed over into the bodybuilding steroid cycle instead of the testosterone replacement therapy cycle. Health risks begin to increase rapidly when you get outside of the ranges that doctors prescribe. Will TRT shut down my own testosterone production? Yes. TRT will most likely shut down your own production of testosterone. There is some good news though, because normal production should resume within a few weeks after you stop. But it may take as long as 6 months to get back fully, and it is possible that it could never return to your previous levels. Does TRT affect my sperm count? TRT will reduce your sperm count. Depending on the dosage and the prior production of your testicles, TRT might even lower count by so much it almost becomes an effective birth control method. These changes in sperm levels are not permanent. They do rise back to normal once you come off TRT, though I have heard that it can negatively affect your sperm levels forever. Does TRT increase my libido? For almost all younger men on TRT, it increases libido and strengthens erections. Older men exhibit an increased libido from TRT, but don't gain as much in the erection department. Is TRT bad for my heart? The general perception for the uneducated is that high levels of testosterone will give you a heart attack. I think this belief is fueled by the images of juiced up bodybuilders that abuse drugs to change their physique at the expenses of their health. Optimal hormone levels are good for your health. This is true of testosterone too. That's why I'm so keen for you to try and get within the ideal range naturally. In light of this, if you are unable to get your T levels up without a prescription, it should come as little surprise that using TRT to reach optimal levels can actually be good for your heart. The Journal of American Heart Association published a meta-study, over 100 individual studies, that found higher levels of testosterone still within normal ranges were essential to heart health. Just to be clear, I'm talking about optimal levels here, not the crazy levels that pro bodybuilders pump into their systems. Are there any health risks I should know about? Generally, the biggest danger from TRT is a possible thickening of the blood due to increased hematocrit. A consequence of this is an increased risk of stroke. This can be managed by donating blood, but it's still a pretty big concern and undertaking you must consider. If blood tests reveal your hematocrit to be above 50%, then I'd urge you to speak to your doctor. Take responsibility for your health. Don't look for a quick fix. So there you have it, my summary of the pros and cons of TRT. If you want my honest opinion, you should do everything you possibly can to get your natural levels up and avoid TRT, unless it's the only viable option. I mean, spend a couple years trying to get your natural levels up. It's never a quick fix. Even then, it must be closely monitored by a doctor who is an expert in the area. This will minimize your risks of the potential side effects, but it will not eliminate them. You must be aware of the risks. Thriving with perfect T levels will allow you to live the life you want, but before you dive into the apparent quick fix of TRT, weigh up the risk to return ratio. If you think you'd be far better served focusing on eating right, prioritizing sleep, training well, and using supplements like Man Sleep and Man Boost to put yourself in the best possible position safely, then do that. If you do, you'll have more energy, better mood, build more muscle, get leaner, have greater ability to focus and recover faster. So personally, these have helped me to achieve a lot more. They've helped me build the body and the life that allows me to live life on my terms. For guys with low T, Man Boost has proven to be a safe, effective supplement that provides life-changing results. You could get all these benefits too. Get your diet, training, and sleep on point, supplement these habits with Man Boost and it'll change your life. Remember, you can get it at the lowest possible price in the link below. But again, if you're talking about getting TRT, try the natural way first. Try the natural way for a year or two at least, and you can turn things around. Trust me. Take care.